Ever get that feeling that things are looking a little fuzzy? Kind of like you're peering through a foggy window. Or maybe colors seem a bit washed out. You might be dealing with cataracts.
Mm.
And we've got a whole bunch of research papers here, all about cataracts. You know what they are, and the symptoms to keep an eye out for,
hmm
and even some pretty cutting-edge treatments.
Yeah, cataracts are really common, especially as we age, but the good news is there's actually a lot we can do about them.
So let's break it down for our listeners, like what's actually going on inside our eyes when these cataracts start forming.
Well, think of the natural lens in your eye, the part that helps focus light. A cataract forms when that lens, that should be clear, gets cloudy. And that cloudiness, it blocks the light from passing through as clearly as it should, which is why things start looking blurry.
So it's kind of like smudging your glasses, but it's happening inside your eye, right? And you mentioned that they're more common as we get older. So what exactly is happening there?
Basically, as we age, the proteins in our lenses can clump together, and it's these clumps that cause those cloudy patches I was talking about. It's gradual, though, and not everyone develops them at the same rate.
So it's not like you wake up one day and bam, you've got cataracts.
Yeah.
It's more of a slow process.
Yeah.
Okay, that makes sense.
Uh-huh.
But what about the symptoms? I'm guessing blurry vision is the most obvious one, right?
Yeah, blurry vision is definitely a big one. But there are other signs, too. You might notice that colors look faded, almost washed out, like less vibrant. Or you might find yourself getting bothered by glare, especially from headlights when you're driving at night.
Right. That makes sense. If the light isn't passing through that lens cleanly, it's going to scatter and create more glare. And I've heard that sometimes cataracts can even cause double vision, but only in one eye. Is that right?
That's right. Double vision in one eye can be a symptom of a few different conditions, but cataracts can definitely be a factor. There's actually a really interesting case study. It was from 2025 by Al Fattel. They had a young patient who had a rare genetic condition that was causing cataracts. And this patient experienced something called exotropia.
Exotropia. That sounds a bit intense.
It is. Basically, one of the eyes turns outward. And because the eyes aren't working together properly anymore, this misalignment can cause double vision.
Wow. Okay. So if anyone out there is seeing double, even if it's just in one eye, it's definitely a sign to get to the eye doctor, like ASAP. And we've talked a lot about age being a risk factor, but are there any other things that can increase our chances of developing cataracts?
Oh, absolutely. Along with age, things like diabetes, smoking, and spending too much time in the sun without protection, those can all increase your risk. Even certain medications can have an effect. For instance, there's a class of drugs called oral alpha-1 antagonists. They can actually complicate cataract surgery because of something called floppy iris syndrome.
Floppy iris syndrome. Okay, I've never heard of that. What is that exactly?
Well, the iris, that's the colored part of your eye that controls how much light gets into the pupil. And with this syndrome, the iris gets, well, floppy. It doesn't dilate or constrict the way it should, which makes it a lot harder to perform cataract surgery.
So it's like trying to hit a moving target, basically. That must make things really tricky for the surgeon.
Exactly.
Okay, so we've got a good handle on what cataracts are and what can cause them, but what can people actually do about them? Is there a way to, like, reverse that cloudiness, or do you just kind of have to live with blurry vision?
Unfortunately, there's no magic cure to make cataracts disappear. But the good news is we have a very effective treatment option: cataract surgery.
Okay, so let's talk surgery. Is it a scary procedure? What exactly happens during cataract surgery?
Yeah, cataract surgery has come such a long way. It's actually one of the most common and most successful surgeries out there these days. It's usually done as an outpatient procedure too, which means you can go home the same day.
Okay, that's less intimidating than I thought.
Yeah.
So walk me through it. What actually happens during the surgery?
Well, the most widely used technique is called phacoemulsification. It uses ultrasound waves to break up that cloudy lens into tiny pieces, and then those pieces are gently suctioned out.
So it's like a miniature jackhammer for your eye.
That's actually a pretty good analogy. And once that cloudy lens is removed, we put in a new artificial lens called an intraocular lens, or an IOL for short.
So it's like swapping out a smudged window for a brand new one. That's pretty incredible.
Yeah, it is pretty amazing technology. And there are all sorts of different types of IOLs to choose from now, depending on, your needs and your lifestyle. Some can even correct for astigmatism or presbyopia.
Oh, wow, that's fantastic. So some people can actually ditch their glasses after surgery.
In many cases, yes, that's the goal.
This is really encouraging. It sounds like cataract surgery has gotten so advanced and personalized. But are there any downsides? Any risks or complications we should be aware of?
Well, like any surgery, there are always some risks involved. But serious complications from cataract surgery are actually pretty rare.
And of course, finding an experienced surgeon is always key. Speaking of experienced surgeons, I understand we've got a renowned expert on the show today.
Yes. We'll be talking about Prof. Dr. Suhail Sarwar, a top eye and cataract surgeon in Lahore, Pakistan.
And what makes Professor Sarwar stand out in this field?
We don't have his research papers included in our materials here today, but his reputation for excellence in cataract surgery is widely known. It speaks volumes about his skill and dedication to his patients.
So if you're in Pakistan and dealing with cataracts, Professor Sarwar seems like someone to consider. Before we wrap up this part of our deep dive, though, let's take a step back and give our listeners a quick recap.
Sounds good.
All right, so remember everyone, cataracts are a common part of aging. If you're experiencing blurry vision, if colors seem faded, or you're bothered by glare, especially at night, it's a good idea to get your eyes checked. And the good news is, cataract surgery is a safe and effective treatment that can actually restore your vision and really improve your quality of life.
Yeah. And if you're thinking about cataract surgery, it's super important to talk to your eye doctor about your needs and preferences. They can help you decide on the best approach and make sure you get the best outcome.
Absolutely. Finding the right treatment for each person is key. And that's all for this part of our cataract deep dive.
Welcome back to our deep dive on cataracts. It's incredible, how much research is being done in this field. Scientists are constantly learning new things about, well, how cataracts develop and how we can treat them more effectively.
Yeah, it's amazing to think that something as small as the lens in our eye can have such a big impact on our lives.
It really can. And one area of research that I find particularly fascinating is how cataracts can affect our balance.
Really? So it's not just about seeing clearly, it's about like being steady on our feet too.
Exactly. There is a study, I think it was from 2025 by Azevedo, where researchers actually use smartphones to measure balance control in patients before and after cataract surgery. And what they found was, well, pretty surprising.
Okay, I'm all ears. Tell me more.
So before the surgery, the patients had much more postural instability, especially in well-lit environments. And this suggests that the glare from the cataracts could actually be a bigger factor in balance issues than we initially thought.
So it's not just that people are, tripping over things they can't see clearly. It's the glare itself that's throwing them off balance.
That's the theory. And the really interesting part is that after having cataract surgery, their balance control significantly improved.
Wow, that's a pretty good reason to address cataracts sooner rather than later, right? It's not just about improving vision. It's about, feeling more confident in your movements and reducing the risk of falling.
Exactly. And it really just reinforces the importance of early detection and seeking treatment when it's necessary.
For sure. And speaking of treatment, I want to talk more about those artificial lenses, the IOLs, that are implanted during cataract surgery. We mentioned them briefly in the last part, but I'd love to learn more about the different types that are available.
Well, there are a lot of options these days, which is great because it lets us really tailor the treatment to each patient's individual needs.
So this is not a one-size-fits-all kind of thing.
Not at all. So we have monofocal IOLs, which basically provide clear vision at a single distance, usually far away. These are a good choice for people who are okay with wearing glasses for reading or close-up work.
Okay, so monofocal is kind of like having a permanent contact lens set for distance vision. Got it. What other options are there?
Well, then we have multifocal IOLs, which, as the name implies, provide clear vision at multiple distances. So you might be able to see clearly far away, at arm's length, and up close, all without needing glasses.
Oh, wow, that's like having built-in trifocals. That sounds amazing.
It can be really great for some patients, but it's important to mention that multifocal IOLs can sometimes cause halos or glare, especially at night. Not everyone adapts well to them.
So it's important to really talk to your eye doctor about your lifestyle and, your visual needs to figure out which type of IOL is the right fit for you. What about astigmatism? Can IOLs help with that too?
Yeah, absolutely. We also have what are called toric IOLs, and these are designed specifically to correct astigmatism. They're like custom-made lenses that can compensate for the irregular curvature of the cornea, which is what causes astigmatism in the first place.
So potentially you could actually say goodbye to your astigmatism glasses after surgery.
Yeah, it's definitely a possibility. And the technology for implanting these specialized IOLs is constantly getting better.
In what way?
Well, traditionally, surgeons used to have to use manual marking techniques to make sure those toric IOLs were aligned properly within the eye. But now we have this markerless technology that uses, like, advanced imaging and guidance systems to make sure they're placed even more accurately.
Whoa, that's super high tech. And I imagine that precision is really important when it comes to getting the best possible vision.
You're absolutely right. Every degree makes a difference. And there's actually ongoing research comparing these different techniques to see which ones are consistently delivering the best results.
It's incredible to see how far things have come with eye surgery. It's really
Yeah.
giving people a lot more options for getting clear vision. But I want to shift gears for a minute and talk about the patient experience, like the psychological side of things. I imagine it can be kind of scary for some people to have eye surgery.
Oh, of course. Any surgery, even a relatively routine one like cataract surgery, can definitely cause some anxiety. And there's actually research being done right now to explore ways to better support patients emotionally throughout the process.
That's really great to hear. Are there any particular studies that come to mind?
Well, there's one from 2025 by Hong that looked at anxiety and pain levels in patients undergoing something called immediate sequential bilateral cataract surgery.
Immediate sequential. Wow, that's a mouthful. What is that exactly?
It's where they operate on both eyes during the same day.
Oh, wow. I bet that would make people pretty anxious.
You would think so, right? But the interesting thing is that even though the pain levels were basically the same between the first and second surgeries, anxiety levels were actually much lower before that second surgery.
So maybe going through that first surgery helps to sort of ease the fear of the unknown.
Yeah, that's one possible explanation. It could be that the patients feel more confident and reassured after getting through that first procedure successfully. It really shows how important patient education and communication are, throughout the entire process.
Absolutely. Knowing what to expect can make a huge difference. And speaking of knowing what to expect, let's talk about another really interesting area of research. The role of genetics in cataract development. We know that age is a big factor, but what about our genes?
Well, genetics definitely play a role, especially when cataracts develop at a younger age. Remember that study by Al-Fadhel we talked about earlier, the one with the patient who had exotropia?
Yeah, the one with the rare genetic condition, right?
Right. Well, their cataracts were actually caused by a mutation in a specific gene called SPAGE9. And this gene is involved in all sorts of important cellular processes, things like cell survival, growth, and signaling pathways. And when it's mutated, it can mess up the normal development of the lens, which can then lead to cataracts.
So one tiny gene mutation can have this cascading effect on eye health.
Exactly. And that's why genetic testing and research are so crucial. The more we can understand about the genetic basis of cataracts, the better we'll be able to, develop treatments that are more targeted and maybe even prevent certain types of cataracts from developing in the first place.
That's really amazing. It's like we're unlocking these secrets hidden in our DNA to find new and more effective treatments.
Exactly. And that's just one example of how researchers are really digging deep into the cellular and molecular mechanisms behind cataracts. There's so much fascinating research going on.
And I'm sure we'll uncover even more in part 3 of our deep dive. Welcome back to the deep dive.
It's pretty wild, right? Like, the more we dig into all this research on cataracts, the more we realize there's so much to learn and so many different things that affect them.
Absolutely. And you know what? Some of this research is actually turning our assumptions about cataracts and how we treat them upside down.
Okay, now I'm really curious. Give me an example. What assumptions are we talking about here? Well, for example, you would think that men and women, if they're the same age and in roughly the same health, they should have similar outcomes after cataract surgery, right?
Yeah, that makes sense. I mean, the procedure's the same, isn't it?
Exactly. But a study from 2025 by Ben Eli actually found something pretty unexpected. It turns out that men, specifically between the ages of 65 and 75, had significantly better vision after surgery compared to women in that same age group.
Wait a minute. So even though the surgery was just as successful in both groups, the men ended up with better vision overall. How is that even possible?
Well, that's the million-dollar question. And it really highlights the fact that we still have a lot to learn about how our bodies change as we age and how those changes can actually affect things like surgical outcomes.
It really underscores that whole idea of a personalized medicine, doesn't it? The idea that we need to consider each person's individual differences instead of just taking a one-size-fits-all approach.
Exactly. And it also reminds us that we need to look beyond just the immediate results of a surgery and think about the long-term impact on the patient's quality of life.
That's a really good point. It's not just about making sure the surgery was technically a success, but about how it actually translates into better vision and a better life for that person.
Right. And speaking of long-term impact, there's another area of research I think is particularly interesting. The link between cataracts and how well our brains are working, cognitive function.
Yeah, we touched on that in part two, right? The idea that cataracts themselves might be connected to cognitive decline even before having surgery.
Exactly. But there's a lot of debate about whether cataract surgery itself can have any effect on cognitive function, whether it's positive or negative.
So some researchers believe that if you can improve a person's vision, it could potentially improve their thinking abilities too.
That's the idea. The thinking is that if you're able to see the world more clearly, if you can really engage with your surroundings and stay more socially active, that could theoretically benefit your brain health in the long run.
That makes sense intuitively, but what does the research actually tell us?
Well, there have been some mixed results. One study from 2025 by Joe used data from a large study of older adults in the U.S., and they found that cataract surgery didn't really have any significant impact on cognitive function in the year after the surgery.
So no real improvement, but no decline either.
Right. But then there's another study from the UK, also published in 2025, by a research group called SECW, and they actually found that removing cataracts was linked to a slower rate of cognitive decline.
Hold on, so we have two studies both looking at the same thing, but they're reaching opposite conclusions. That's a bit confusing.
I know, it is. And it shows just how tricky it can be to study complicated things like aging and cognition. There are just so many factors involved, and it's hard to pinpoint the specific effects of the cataract surgery itself.
So what's the takeaway for our listeners? What should they make of this conflicting research?
Well, I think the main message is that we need more research. We need larger studies that follow people for a longer period of time. That way we can start to tease apart all the different factors and get a clearer understanding of the relationship between cataract surgery and cognitive health.
That's fair. It reminds us that science is a process, right? We don't always have all the answers right away. But speaking of unanswered questions, there's one more study I wanted to mention. It has to do with the shape of the cornea and how it can actually be affected in subtle ways by cataract surgery.
Ah, yes, that 2025 study by Al-Fakali. Pretty fascinating stuff. You wouldn't think that such a tiny incision would have any noticeable impact on the cornea.
I know, right? I always assumed that the cornea was basically a fixed structure.
Well, it turns out that even the smallest changes can have an effect. Al-Fakali and their team actually discovered that strategically positioning the incision during cataract surgery can optimize the refractive outcomes.
Refractive outcomes. You mean how light bends as it enters the eye?
Exactly. By making the incision in a specific spot on the cornea, the steeper part, they could slightly change the way light is focused, and that led to sharper vision for the patients.
So it's kind of like fine-tuning an instrument, to get the best sound possible. It's amazing how every little detail matters.
I agree. It really speaks to the amazing skills of these cataract surgeons who are always looking for ways to refine their techniques and get the best results for their patients.
It really is remarkable. Well, I think we've covered a lot of ground in this deep dive. We've learned about what causes cataracts, the symptoms to watch out for, the latest treatment options, and some of the really interesting research that's happening in the field.
And we've learned that there's still so much more to discover, which is always exciting for researchers like me.
Absolutely. So to all our listeners out there, remember, cataracts are common, but they're treatable. Early detection is key, so don't wait to get your eyes checked regularly.
And if you are dealing with cataracts, talk to your eye doctor about what you can do. There are some incredible advancements in cataract surgery now that can really restore your vision and give you a better quality of life.
Well said. And that wraps up our deep dive into the world of cataracts. We'll see you next time on The Deep Dive, where we'll explore another fascinating topic.